Hi, my name is Brad Siff. I'm the founder and president of BioWave Corporation. This is our first webinar, and it's on BioWrap Wearable Compression Electrode Technology and the application and benefits for use with our patented high-frequency peripheral nerve stimulation system. So first, it's really important to understand how our high-frequency peripheral nerve stimulation technology works before we get into the discussion of the new BioWrap technology. So at a very high level, our high-frequency peripheral nerve stimulation technology is a patented deep tissue technology that uses high-frequency signals. The active electrical field that forms inside a body hyperpolarizes C fibers, so it actually inhibits the transmission of pain signals along pain nerves. It actually inhibits action potential propagation along the nerve. Patients receive just over 8 hours of continued pain relief following a 30-minute duration treatment. The active electrical field inside the body treats both nociceptive as well as neuropathic pain conditions. Our signal technology is the only one on the market that has an active feedback control built into it, which prevents patients from receiving a burn. It prevents the patient from going to too high a signal level automatically and in real time. And our devices are really easy to use. It's basically a power button and a plus button to increase the intensity and control your comfort level. There's no programming. And the sensation felt by the patient is a deep, smooth pressure sensation. It's very comfortable. So patient compliance is excellent using all of our devices. The most recent published study was in the journal Pain Practice. It was from June of 2021. It was an open label pilot study investigating non-invasive high-frequency peripheral nerve fiber stimulation in chronic pain patients. The lead investigator was Dr. Dominic Hegarty. He is president of the World Institute of Pain. In this study, we examined 463 patients. The outcomes included an average of 3.1 was the reduction in the VRS pain score. Just over 8 hours was the average duration of pain relief following a 30-minute treatment. 54% of patients in this study reduced and in some cases eliminated their pain medication consumption. And all of these patients who had to use BioWave for at least a minimum period of 2 weeks, 98% of them reported that they wanted to continue to use BioWave to treat and manage their chronic pain. So how does this high-frequency signal technology work? So in order to affect a nerve fiber in the body, you have to encompass it with a low-frequency electrical field. We define low frequency 1 hertz to about 180 hertz in frequency. The problem is that the electrical properties of skin, the impedance, the capacitance, prevent low-frequency signals from passing through the skin. And that's a fundamental issue with TENS, transcutaneous electrical nerve stimulation. We know that high-frequency signals, and we define that as greater than 1,000 hertz in frequency, can pass through skin into deep tissue, but individually don't necessarily have an effect on C fibers and A delta fibers. So what we discovered is if you add together 2 high-frequency signals, and we're using 4,000 hertz and 3,878 hertz. When you add them together and deliver them to a single electrode, they will pass through the skin into deep tissue. And what we discovered is when they pass into deep tissue and they hit any polarized structure, so for example, the membrane of the C fiber or the A delta fiber or muscle tissue, that plus charge sitting at the surface of the nerve causes these 2 high-frequency signals to multiply together. And the multiplication of these two signals creates a new spectrum of signals that forms in a 3.5-inch diameter hemisphere beneath where that first electrode is. So the result of the multiplication provides 3 high-frequency signals, a low-frequency signal, and harmonics on the low frequency. So the invention is that we found a way to get the body to produce a low-frequency electrical field inside the body, right at the surface of pain nerves, where it's actually encompassing the pain nerves. So how does this device work? So we deliver that first high frequency signal to the first electrode. The active electrical field forms in that hemisphere beneath the first electrode, encompassing all the pain nerves beneath where that electrode is placed. Then the device immediately delivers the high frequency signals to the second electrode. The high frequencies pass through skin into deep tissue. They hit polarized structures. The active electrical field forms in the hemisphere beneath the second electrode. We capture pain nerves in that volume of tissue as well. So BioWave is an alternating current device. What does that mean? It means that the device alternates the delivery of the high frequencies back and forth so quickly between the two electrodes that the body never realizes the signals have left either location. So the net effect, it's as if you're treating 2 distinct volumes of tissue simultaneously. As a result, electrodes must be placed directly over locations of pain. We never surround the pain site like you would with TENS, interferential, or muscle stimulation types of devices. So, what are some of the mechanisms of action that are occurring in these 2 hemispheres beneath each of the 2 electrodes? Well, the effect on the C fibers is that the active electrical field actually hyperpolarizes the C fiber. So because it hyperpolarizes the C fiber, it inhibits or prevents the sodium-potassium ion exchange across the membrane of the C fiber. So that plus charge, which is the pain impulse or the action potential, can't form on the inside of the C fiber. So the active electrical field is inhibiting action potential propagation along the nerve. And this mechanism of action is called frequency conduction block. This is not based on gate control theory like TENS. The active electrical field also has an effect on the A delta fibers in that hyposthesia develops, it's induced about 5 minutes into the treatment. So if the duration of an active treatment is 30 minutes, you have this loss of proprioception, some light numbness that forms in the region around both electrodes, and that hyposthesia lasts for about 30 minutes following a 30-minute duration treatment. Kind of wears off linearly over the 30 minutes following the treatment. In addition, there's increased blood flow through that volume of tissue where the active electrical field forms. It's not because of vasodilation, it's because components of blood have a charge associated with them. And when a charged particle enters an electrical field, it has to be accelerated through that field. So that's why we see increased blood flow through the volumes of tissue where that the active electrical field is present. Additionally, muscle tissue is polarized, and the effect that the electrical field has on the muscle tissue is it holds it in tension during the treatment. So that's why the treatment feels like a deep, smooth pressure sensation, and it's much more comfortable than other forms of electrical stimulation. So as a result, patient compliance is excellent. Patients love the way the treatment feels, separate from the fact that it works much better. And comes in terms of mechanisms of action is the very long carryover effect following the 30-minute treatment. As I mentioned in the most recent clinical study, and this is common with all of our clinical data, patients have on average a little over 8 hours of continued pain relief from a 30-minute duration treatment. In fact, many patients get up to 24 hours of continued pain relief from a 30-minute duration treatment. And the hypothesis as to why we see this empirically when BioWave is used is because we actually are the electrical fields affecting the pain nerves directly in deep tissue. And because of that, the thought is that it allows the body to be more efficient at the production of its own endogenous opiates, like endorphins, enkephalins, and serotonin. So we have this advanced high-frequency signal technology. What if you could significantly improve the electrode technology through which this high-frequency peripheral nerve stimulation is delivered? So the result is we developed this new technology called BioWraps. BioWraps are a wearable compression electrode technology. They can treat up to 5 times the treatment area as compared to conventional 2-inch diameter gel-based electrodes. The other advantages of the BioWraps are that they provide compression simultaneously while allowing the delivery of the high-frequency signals into deep tissue. There's no guesswork as to electrode placement location because the electrodes are fixed within the wearable garment. The BioWraps are reusable. They're easily cleaned using skin disinfectant wipes on the silver fabric electrodes. And we also provide a 1-year warranty on all BioWraps. So we've designed BioWraps for many different parts of the body. The back BioWrap is already in production and it's available for sale right now. We have a knee BioWrap and a foot ankle BioWrap that are being launched the first week of April 2022. And these BioWraps with this advanced silver fabric technology can be used with our BioWave Pro device and our BioWave Home prescription device. All the BioWraps come in 2 different sizes, a small medium size and a large extra large size. And the BioWraps, in this case, the ones on the extremities, the knee and the foot ankle, can be used both on right side or left side. Some specifics in the design of the BioWraps. This is the back BioWrap, and we've built in very large 5.5-inch by 3-inch bilateral lumbar silver fabric electrode. So a patient can really get a treatment across the entire lumbar region of their back. There's single compression from the primary strap and the Velcro closure. These are made out of a very high quality neoprene fabric. The back BioWrap also has designed in a secondary compression straps so they can be with Velcro closures, so they can be pulled off, pulled forward, and strapped and Velcroed tight. So you really get excellent compression while you're getting the BioWave treatment. On the knee BioWrap, we've designed in silver fabric electrodes that cover the entire medial and lateral aspect of the knee over the joint line. We also cover most of the anterior of the knee. And one of the straps provides compression directly over the silver fabric electrodes. The second elastic strap provides compression over the distal end of the thigh to help hold the whole wrap in place. So it can be used to treat pain that results from ligament sprains, pain from osteoarthritis, meniscus pain, postoperative pain, almost any type of pain that presents in the knee. And this knee BioWrap can be applied to the right knee or the left knee. We've also designed this foot ankle BioWrap, and what's really unique here is we designed a circumferential electrode that goes just above the ankle, and so it goes all the way around the perimeter of the ankle, above the ankle, and a second circumferential electrode that goes all the way around the perimeter of the foot. This allows you to capture all of the nerves running through the ankle and the foot. When you treat with this, it feels like the entire ankle and foot are being stimulated. This device has individual compression over each silver fabric electrode, so you can control individually how much compression you want. We target the tibial nerve, the medial and lateral plantar nerves with this device, and you can treat pain resulting from tendinopathies, from sprains, from painful diabetic neuropathy, PDN, from other neuropathic pain conditions, or postoperative pain conditions in the foot. And again, this device can be used either on the left foot or the right foot. We've also designed an elbow BioWrap. The electrode placement provides treatment both on the medial and lateral aspect of the elbow, so it's a bilateral elbow electrode location. One elastic strap provides compression directly over both silver fabric electrodes. The second strap provides compression over the distal end of the biceps and the triceps, which helps hold the whole wrap in place. This wrap targets the radial and ulnar nerves. You can treat any type of chronic or acute pain throughout the joint, and this device can be applied to the right or the left elbow. We've also designed a hand wrist BioWrap. This BioWrap, like the foot ankle BioWrap, has a circumferential electrode design. So there's one electrode that goes completely around the hand. There's a second electrode that goes completely around the wrist. And we're capturing all the nerves that are traveling down through to the fingertips, which includes the radial nerve, the median nerve, and the ulnar nerves. You're getting individual compression around the hand and individual compression around the wrist, so both can be adjusted individually. We can treat any type of chronic or acute pain throughout the hand or wrist, including tendinopathies, pain from carpal tunnel syndrome, postoperative pain, as an example. And this device also, the same device can be applied to either the right hand or the left hand and wrist. Finally, we've designed an Extremity BioWrap, and this has designed in very large 4.75 inch by 3.75 inch silver fabric electrodes. They literally allow you to treat an 11 inch by 8 inch volume of tissue, and this is designed to be used anywhere around the thigh or the calf, so you can treat pain throughout the hamstring, throughout the quadriceps, the IT band, abductor, adductor, and the smaller version of the device can be used to treat the calf or shin splints. There's two compression straps, so you're getting individual compression over each of the two electrodes, and this device can be applied to the right or left thigh or calf. We've also designed a shoulder BioWrap, but we're in the midst of that design, so I don't have an example of what that looks like right now. It's a more complicated design, but it's going to enable us to treat various different aspects of the shoulder. These last three wraps, the elbow, hand, wrist, and the Extremity BioWrap, we expect to be available in late May to purchase. The treatment protocol when using BioWraps is similar to our conventional electrodes. It's a 30-minute duration treatment. We recommend starting with 2 to 3 treatments per day. Multiple treatments can provide a cumulative benefit, and the best way to do that is to separate each treatment by about 30 minutes. So you do a 30-minute treatment, you wait 30 minutes, you do another 30-minute treatment, and that will give you the greatest cumulative benefits. There's no limit to the number of treatments you can do. Patients can treat on an as-needed basis, but eventually patients usually need only 1 or 2 treatments a day to completely manage their pain. Both doctors and patients do report that there are cumulative benefits, as I mentioned, with multiple treatments. From a reimbursement standpoint, coverage is available for all BioWave high-frequency neurostimulators, electrodes, and BioWraps. So in the Veterans Administration, in VA hospitals and clinics, BioWraps, all BioWraps are available on our Federal Supply Schedule price list. They're part of the existing contract that we have in place. In college and high school sports, we have an athlete insurance program, and we have contracts in place with AG administrators and BMI, and BioWave will manage the entire process for the athletic trainer. In pro sports, we have workers' compensation contracts in place with most major work comp carriers, and similarly in pain, ortho, and spine clinics, we have workers' compensation contracts in place with most major workers' compensation carriers. So in summary, we have this advanced high-frequency peripheral nerve stimulation technology combined with our new patented BioWrap wearable electrode garment technology that makes for a very advanced offering for patients to treat any type of chronic or acute pain. The key benefits from this combination are just over 8 hours of continued relief from a single 30-minute duration treatment. The BioWraps allow you to treat up to a 5 times larger volume of tissue as compared to a 2-inch diameter conventional gel electrode. There's no programming, so it's very easy to use. Literally, it's a power button and a plus button to control your comfort level. Super easy for the provider to explain to the patient and super easy for the patient to use. And as I mentioned earlier, the treatment is very comfortable. It feels like a deep, smooth pressure sensation. So patient compliance using our devices is excellent. For more information, please contact us. You can send an email to info@biowave.com or call our toll-free number 1-877-BioWave. Thank you very much. I know you must have a lot of questions from this presentation, so we're ready to take questions from the audience. We'll try and get everybody's questions answered. Okay, so for people, for questions, there's a little Q&A button on the bottom right side, toward the right side of your Zoom screen. If you could click on that, and in the window that pops up, you can actually ask a question right there. One of the first questions I've been asked is, how can we, using about the same amount of, with the same power source we have, deliver all that energy through the much larger that are designed into the BioWraps? And it's a very good question. And what we discovered is, if we could reduce the impedance of the skin, we could deliver our BioWave signal technology through a much larger area and provide a much better clinical outcome. So to do that, we developed a special conductive cream, and this comes with every BioWrap. And basically, you just need to use a pea-size amount that you place on your finger, and it's literally that much. Here we go. It's just a little bit, and you rub it in thoroughly into the 2 locations where the silver fabric touches the skin. It doesn't have to be exact. If you have the back BioWrap, for example, you're going to rub it across the entire lumbar area. It's okay if it goes beyond or across the spine. It's very simple. You want to make sure you rub it in well. This, by doing that, you dramatically reduce the impedance of the skin. And now we can, with our same BioWave home device or BioWave Pro device, deliver our signals through, and we're just treating up to 5 times the volume of tissue. So that's an important part of how we get the technology to work so well. Another question I have here is, how do we have a rep come to the office to see the products? So if you call our 877 BioWave phone number, 1-877 BioWave, you can ask for our sales folks, and they will set up an in-service for your clinic, whether it's a VA clinic or a pain or ortho clinic or a sports team. Whoever's interested, we're happy to do that. You can also email us at info@biowave.com. Either of those ways it will be the fastest way, and we'll put you in touch with the appropriate person to get that set up. Let's see. Someone asked if they can get a copy of the presentation for their VA partners. Yes, absolutely. We can make this available. We have a list, I believe, of everyone's email who signed up for the webinar, and we will get this sent out. Whoever's interested in having a copy, we could just send it out to the entire group. So we will definitely make it available. Next question. So someone asked, will these wraps not work with the Go unit? And so that is the case. The Go unit can't work at this lower impedance range that we create by putting the conductive cream on the skin. So what we've done is we've designed another line of wraps. We call it the blue line. The silver fabric wraps are our silver line. And the blue line allows us to place Velcro backed 2-inch round electrodes on the inside of the wrap. So, and the blue connectors from our electrodes stick out the back side of the wrap. They're the same. So these are our standard electrodes. These blue connectors stick out the back side, and you can still plug it into a Go device and use it. And so you're not getting the benefit of the larger volume of tissue, but you are getting the benefit of compression simultaneously with the delivery of our high frequency nerve stimulation. And the blue line wraps are available for the back and the knee right now, and they will probably be available for other parts of the body as well. Another question I have is, what is the difference between the home and the Pro? So the Pro unit is really designed to work in a hospital, a clinic, an athletic training room type setting. The device is around the size of a large hardcover book. It's handheld and it is portable, but it has a very large battery system in it, which can provide 18 30-minute treatments. Whereas the home unit is more the size of a large paperback book, handheld, not wearable like the BioWave Go unit is wearable, but BioWave Home goes up to the same maximum output as the BioWave Pro unit, but it has a much smaller battery system. It's not as ruggedized as the BioWave Pro unit, but it is designed for home use, and it can provide 4 30-minute treatments on a single charge of the battery. For all the devices, by the way, when you plug in the AC charger to recharge the battery, That's the only purpose the charger provides. You cannot run the device while it's plugged in. We do that purposely. So that's really the difference between the Home and the Pro. How do regular people in the community get these devices? So there's a couple different ways. The BioWave Go is both an over-the-counter as well as a prescription device. So if someone wants just to buy it over the counter, they can buy it through our website at biowavego.com, or you can access it through biowave.com. And you can just purchase it directly through our website. You can also purchase the device on Amazon, and I believe it's available on other locations like walgreens.com and cvs.com. You can also go to the HSA FSA store and buy BioWave Go there and use any funds that patients have stored in HSA or FSA accounts. So that's somewhat can be somewhat of a savings as a way for a patient to buy it. And then you can also get a prescription through our website. You can come and get a BioWave Go device through a prescription. There's a prescription form you can download. You can take that to your doctor. There's also, we have a telehealth option, so a patient can come in and get a prescription immediately through a telehealth option. So those are the various ways that someone, if a patient just wants to try and get one of our devices. BioWave home devices are also available via prescription only on the BioWave home device. Let me see who else. Difference between that's all I have right now. Is there any other questions that I'd be happy to answer? Anything else? And again, you can always reach out to us via info@biowave.com or call our toll-free number. If you want to ask me a question directly, when you call the toll-free number, just ask for me, and you'll get transferred to me. And I'm happy, if you want to talk about something offline or have a more technical or clinical question, my door is always open. I'm very happy to answer any and all questions. Do you have anything else? I think that's everything. So anyway, I want to thank everybody for attending. I greatly appreciate your time. And we will be running these webinars once a month on the 15th of the month. And the next webinar is going to be focused on chronic low back pain and different applications and how BioWave can be used to help with these various different applications for chronic low back pain. So again, thank you very much for your time. And I hope you will continue to enjoy our webinars. Thank you.